Hi everyone, I'm Dr. Scott Saunders of Healthy Mouth Media, and I'm here with my good friend Dr. Felix Liao. Dr. Liao is a health innovator with a new solution that integrates airway with a bone-building diet with his new book, License to Thrive, a mouth owner's GPS to vibrant health and innate immunity. Dr. Liao is the author of two very popular books, 6-Foot Tiger, 3-Foot Cage, and Early Sirens. And I am super excited to have Dr. Felix here to tell us all about his brand new book, License to Thrive, a mouth owner's GPS to vibrant health and innate immunity. Dr. Felix, thanks so much for joining me.
It's a great pleasure to be here, Scott. It's an honor, and I'm super excited to contribute to Healthy Mouth Media as a aligned cause.
Great to have you here, and we appreciate your collaboration. So for perspective, Dr. Felix, a brief recap. Your first book, 6-Foot Tiger, 3-Foot Cage, great book with a memorable title. How did you come up with that title?
Thank you for asking that. I was trying to explain how the mouth is connected to sleep, airway, and energy to patients. And I kept scratching my head because whatever I said about a DNA appliance or epigenetic appliance, they would just look at me with a blank stare. And when their eyebrows went up in understanding, I said, I've got it. When I said, oh, it's because there's a discrepancy between your jaw size, 3-foot cage, and your tongue size, 6-foot tiger. So that's how it came about. I was looking for a way to explain to people how the mouth is connected to the airway with jaw size, because the space between the upper and the lower jaw is the home office for the tongue.
And that's good language, and it's a good metaphor, and I think that will stick in people's minds and kind of get them aligned to just how important it is to have a healthy airway and how mouth size relates to that.
And now, very often, if I may, often the 3-foot cage is a source of undiagnosed problem in both dentistry and in medicine. And that's not on the doctor's radars yet.
And what does the mouth have to do with innate immunity? What does the mouth have to do with immunity in general?
So most people don't know this, and I certainly didn't learn this in dental school or in any of the CE courses I've taken in dentistry or medicine. That is that if you eat sugar, your natural killer cells are inactivated for 5 hours. So how you eat affects your immune system. And you know how long it takes to recover? 5 times that.
Wow.
Okay. So this is a big deal. And also sleep and airway are connected to jaw size, as we have established. And so if you're stuck with a 3-foot cage, it's not like your pinchy glasses or your high heels that you can take off when you go to bed. All right, you're stuck with it 24/7 for all your life until someone who's trained to recognize the 3-foot cage comes to your rescue. So sleep affects immunity. Everybody knows that. When you get sick with a cold, common cold or flu, what would your grandma tell you? Go to sleep. Well, sleep makes you feel better, but there's a predicate. Predicate is that you have a airway that is not obstructed. In fact, the more open your airway is, the better you can recover. The quicker recovery is, the more complete it is, and the less severe your symptoms are.
So the better your airway health, the better your immune system health. Is that what you're saying?
Absolutely. And that's how it's tied structurally back to the 3-foot cage.
Yeah. Now, your new book is a great read for both consumers and dentists and other healthcare professionals alike, right?
Yes. This stuff is so new that when a patient reads this book, he or she is going to know more than the combination of their doctors and dentists' knowledge in this area, on this topic. because this is just not mentioned either in medical or dental schools or in continuing education circuits yet. That's why I wrote the book.
Finally, Dr. Felix, can you give our consumer audience members and parents some key takeaways that they can expect when they read License to Thrive?
Sure. The roots to trees, okay, is what our mouth is to humans. So every one of us grow from our mouth. Every one of us, when we were newborns, we couldn't hold up our heads, but we could suck for dear life. It is through repeated cycles of sleeping and feeding that we grow. So contrary to popular belief, our foundation as humans is not our feet, but our mouth, okay? So if your mouth is off structurally, the rest of your body is stacked incorrectly against gravity. That's a source of aches and pain and fatigue.
And that's what you caption as impaired mouth syndrome, right?
Absolutely.
How can we recognize that?
Okay, so impaired mouth syndrome has got both dental and medical symptoms. The dental symptoms are very common: crowded lower front teeth, TMJ clicks, gum recession, sensitive teeth, one dental trouble after another, bony growth on the palate or inside the lower jaw, history for teeth extraction for braces, malocclusion, like crossbite, open bite. These are very common dental problems for which dentists really don't have good solutions, not even orthodontics. Because I see a lot of post-orthodontic issues that couldn't be solved elsewhere. And then the impaired mouth syndrome on the medical side is primarily sleep apnea, teeth grind, erectile dysfunction, body aches from head ache down to neck, to shoulders to back.
Right.
I've had patients' knee and ankle pain get better from what I do in the mouth.
This approach can do a lot to improve the general health of both adults and children, correct?
Absolutely. So the solution to impaired mouth syndrome is what I call a holistic mouth solutions. That's a combination of eating right so that your children's face and jaws develop to their full genetic potential. That means room for all 30 teeth, so all 32 teeth to line up straight. And in between the two jaws, enough space for the tongue to function and stay in the mouth without plugging the airway.
And that's all about optimal dental facial development, especially in children.
Yes.
And early intervention is key for that, right?
Yes. Form equals function. Structure equals health.
Yeah.
And this is what we do, is develop that from a combination of epigenetic oral appliance therapy in the case of adults and a GPS to guide you on how to eat so that you do not go in the wrong direction that lands you in the leading causes of death.
And Dr. Felix is offering a free PDF download that gives an overview of License to Thrive. And to get that, you just click the link below and we'll update you as needed with any new developments on availability of the latest from Dr. Felix. Stay tuned. I've been speaking with Dr. Felix Liao, the holistic mouth doctor. His new book is called License to Thrive, a mouth owner's GPS to vibrant health and innate immunity. Dr. Felix, thank you so much for being with us. I'm sure our clinician and consumer audience members will love your new book.
Thank you so very much. It's a great pleasure and an honor to be speaking with you and contributing to your cause, Healthy Mouth.
License to Thrive, a mouth owner's GPS to vibrant health and innate immunity by Dr. Felix Liao. Look for it on Amazon.
Thank you.